The Compliance Perspectives podcast is sponsored by Athena, automated compliance training, an employee hotline, and case management all in one tool. Welcome to the Compliance Perspectives podcast. I'm Adam Turtletaub from the Society of Corporate Compliance and Ethics and Healthcare Compliance Association. Joining us today from Salt Lake City is CJ Wolf. CJ is a professor in healthcare administration at BYU, Idaho. And today we're going to be talking about something new in healthcare compliance. CJ, last November, OIG at HHS issued its first industry segment-specific compliance program guidance, or ICPG. Can you give us a background on this effort? Is this one of one, or are many more expected to follow?
Yeah, one of many. And even just to go back 1 year, in April of 2023 at the HCCA's Compliance Institute, the Inspector General announced rolling out the new general compliance program guidance, which they did. And then they rolled out the industry specific. So this is kind of a child of this general compliance program guidance for everyone in healthcare. And then now this ICPG is the first of many.
Much to watch for in the future. So let's go through some of the major elements. First, what does this say about quality of care and life?
That's such a good question. I think nursing facilities, which is what this ICPG is about, is focused on quality of care and life. They said this: OIG includes references to both compliance programs and quality programs throughout the nursing facilities ICPG to emphasize their inextricable link and the need for nursing facility compliance programs to include quality considerations. So they're tied, right? Compliance and quality of care and quality of life, because nursing facility residents often, are living there as well. It's not just the quality of care being provided to them, but it's also the quality as a home. Are there activities going on, and those types of things? So closely tied together.
And that's a significant evolution for compliance programs because it ties them not just to following the laws and regulations, but improving patients' lives. So how about direction for billing requirements? What does it have to say?
Yes. So what's interesting in this ICPG, Adam, is they have, and I haven't seen this before, and I'm wondering if we're going to see a little bit more of this. They have a supplement. So in addition to the whole ICPG, this multi-page document, they link out to a supplement that is specifically on reimbursement. So they do talk about, within the ICPG itself, the importance of billing compliance, right? They say ensuring compliance with Medicare and Medicaid billing requirements should be a core function of nursing facility compliance program operations. So we know that billing compliance has to be a core function of nursing facility compliance programs. And they go into some specifics. They talk about, I'll just be brief here, they talk about the skilled nursing facility prospective payment system, or PPS. They talk about value-based payment models and programs. They talk about Medicare Advantage and Medicaid managed care. They talk about Medicare Part D. And then lastly, they talk about Medicare health plan enrollment for nursing facility residents. So a lot to do with billing compliance. As the OIG says, follow the money, right? So as a compliance officer, we should be following the money, because that's where a lot of compliance issues arise.
Speaking of following the money, it also addresses anti-kickback risks. What does it say specifically?
Yeah, it's such a good question, because, the GCPG, or the General Compliance Program Guidance, talks about the anti-kickback law in general. This ICPG really highlights some specifics that are going to be probably more frequent or maybe even unique to nursing facilities. Here are some examples: free or below fair market value goods and services, discounts, things like price reductions and what's called swapping, arrangements for services and supplies. And then this is interesting: long-term care pharmacy and consultant pharmacist arrangements. And then, of course, nursing facilities have arrangements with hospitals. So hospital arrangements. They also have arrangements with hospice. So hospice arrangements is on that anti-kickback risk list. And then 2 more, care coordination and value-based care arrangements, and then joint ventures. So a lot of interesting, unique, specific kind of discussions on the anti-kickback statute as it relates to nursing facilities.
Now, given this is likely the first of many, are there any lessons here for other segments that are likely to see ICPGs?
Yeah, I think so. The example we just talked about. So the GCPG talks about AKS or anti-kickback statute in general, and then this ICPG, if this is going to be an example of what's to come, we should expect very specific red flags related to the anti-kickback statute, for example, in these particular segment ICPGs that will be coming. Also, we talked a little bit about the billing and coding and reimbursement. There's going to be payment system variations, right? So skilled nursing facilities are reimbursed differently than hospitals, and they're reimbursed differently than Medicare Advantage and reimbursed differently than physicians. But the concepts of the importance of accurate reimbursement methodologies is kind of a general thing, but these ICPGs are getting into the specifics of those payment systems for these segments. And, so we're talking about the nursing facility one, but the OIG has already announced in 2025, they expect Medicare Advantage ICPG to come out. They expect hospital ICPG to come out and clinical laboratory. So 3 that are named, and they're putting a date on it. They're saying in 2025. And then they've named the next 2. They just haven't given a date, probably 2026. The next 2 after those 3 that I just mentioned are pharmaceutical manufacturers, and medical device manufacturers get lumped into that regularly, and then hospice. So I'm really looking forward to see how all these kind of general laws and rules are going to be addressed in each of these ICPGs.
Well, it's going to be interesting to see what comes next. And it's also good to see that there's greater guidance out there available for compliance teams to guide their efforts, but also to demonstrate to management why they're pursuing the activities that they are. Well, CJ, thank you so much for sharing your insights with us today. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.